Thank you very much, Ceann Comhairle. Taoiseach, the HSE is running from one disaster to another in this country. The budget overrun last year of up to €1 billion still goes unrecognised by the state as if it was a couple of €100. Overcrowding in our hospitals in 2023 was the worst on record. Patients on trolleys in University Hospital Limerick for 2023 was 21,143. University Hospital Cork 12,487. University Hospital Galway 8,914. University Hospital Sligo 8,094 and St Vincent's Hospital Dublin 6,555. This is an astonishing figure which goes unnoticed year after year by this and previous governments, leaving the HSE hospital staff burnt out. Shortages of GPs is a cause of huge concern throughout our country, with many GPs reluctant to take on new medical cards patients as it is simply not viable. South Dock services in my own constituency of Cork South West is gone. In most parts of West Cork, only Bantry remaining South Dock service in there. Dentists throughout Ireland are reluctant to take new medical card patients. It is no longer viable for them. In West Cork, the school dentists in Castletownbere, Dunmanway, Scull and Skibbereen have been closed down, leaving parents travelling all over the country to get dental service for their children. Podiatry services for older people are on a very limited basis, now disqualifying many of our genuine elderly needing foot care. We have a severe shortage of HSEOTs, forcing people to pay for their vital service which many can't afford. We have huge waiting lists for physiotherapy, forcing those who can't afford again to pay for the private practitioner. The home help situation is at an all-time low, with carers minding loved ones, pleading for more home help hours and more patients awaiting discharge, but can't as they await a home care package to be put in place due to a lack of home help services. Changes now to home help services in parts of West Cork will see people who had 2 home help hours, 2 home helps a week coming to them will now have 4, but at the same time, not any extension of time, which upsets a lot of people because they built up relationships with their home helpers. Parents of children with additional needs are now waiting for lengthy periods of time to get services such as OT, speech language therapy, psychology therapy and psychiatric services. Respite for adults with intellectual and physical disability has not been available for carers in this country since before COVID. Taoiseach, this is a factual list that surely every politician in the country has. Last week I was speaking with a man in St Vincent's Hospital, Dublin, who spent 18 hours in a chair and 5 days following this on a trolley. Also I spoke to a Clonakilty lady who spent 9 days on a trolley in CUH last week. Taoiseach, who is in charge? Can you tell me where the budget the HSE is getting from, where is it going? And also, can you tell me where did the €1 billion overspend go last year? And do you accept that the HSE as a delivery vehicle for the services I have mentioned above have failed the people miserably? And will we have any accountability?
Thank you, Deputy Taoiseach.
Thank you, Deputy, for his presentation and for raising the issue of health services. I think factually, I presume you know that Bernard Gloucester is the Chief Executive Officer of the HSE and Minister Stephen Donnelly is the Minister for Health in relation to the question of who's in charge. And to say to you that there are about 26,172 more staff now working in our health service than there were at the beginning of 2020. So that's 26,000 extra staff, Deputy, that you have not referenced in your opening remarks. 8,000 plus nurses and midwives, that's a 21% increase. And in fact, if you look at the OECD frameworks and assessment of various health services, we're one of the top in terms of numbers, in terms of nurses per patient across the OECD. 4,000 health and social care professionals additional, and about close to 3,000 doctors and dentists. We have cut costs for patients across the board. As I'm sure you realise, we've removed inpatient hospital charges. We've had the biggest expansion of access to free GP care in the history of the state, to 500,000 more people. That's up to 60% of our population are now eligible for a GP card or a medical card. We've reduced the drug payment scheme costs. We have funded significantly diagnostic scans for patients. We've introduced free contraception to women up to the age of 31. We're publicly, for the first time ever, funding assisted human reproduction, including IVF. And we've agreed a new consultant contract, which I think is very significant in terms of increased activity and in excess of 1,700 consultants have now already signed up to that new consultant contract. And I think, Deputy, in the past 2 years, you must be aware that we've built up an entire new community health service from scratch, including primary care, including chronic disease management and older person services and ambulance services, employing thousands of new people out there in the community. We've increased our acute hospital bed capacity by 1,126 beds over the last 3 years, and we've expanded our ICU capacity by 25%. And new primary care centres have opened up all over the country. We've increased college and training places to deal with, what were challenges in terms of new recruits and so on. 662 student places have been provided in the higher education sector on health-related courses this academic year, including 200 student places across nursing and midwifery therapy professions in Northern Ireland. And today, for every GP who retires now, between 1.5 and 3 new GPs are starting work. And waiting times are coming down, and we have provided a real significant transformation in terms of women's healthcare. More seeing 3 gynae, fertility hubs, specialist menopause clinics. And in the context of what you said, Deputy, the population is rising, has risen very significantly.
Time is up
and that
now,
continues
please.
to place strain on service. I acknowledge that. But you have to acknowledge the enormous increase in investment and resources that actually has occurred.
Deputy Collins.
Thank you very much, Taoiseach, for your reply. You say 26,000 extra staff, but you do admit in the end that we have a huge population growth in this country. So the problem here is that, you're saying we're cutting costs. You're certainly cutting costs, and I told you where all the costs were cut and where all the people are finding extremely difficult to access services. You have over 1 million people, up to 1 million people on waiting lists in this country, some waiting 2, 3, 4, 5 years for simple procedures. There's where the problem is. You opened the new Silverwood new unit in Clonakilty Hospital last week, which is patients have been moved into, which is a positive thing. But the staff had come to me telling me that they were under major pressure, under extreme pressure, and I acted on that. And the old units that have been closed, I want to find out, are they going to be filled with the same amount of people that were in there before? So the same with the mental health unit in Bantry, which we were led to believe would be completed in January 2024, is now being put off till July. Taoiseach, with the Children's Hospital in Dublin getting an increased budget of 510 million this week, bringing the total bill cost to 2.24 million, which was estimated initially would cost 1.73 billion. Now, surely, Taoiseach, what I have told you today shows you something very seriously is wrong with the HSE, and what will this government do about it?
Thank you, Deputy.
I welcome the fact that you've acknowledged government funding for Clonakilty District Hospital. It's not normal pattern of political behaviour on your part to acknowledge government funding where it happens, and I do welcome the fact that government funding has enabled what is, I think we both agree, a fantastic service and facility for the people of Clonakilty and Nadoika Moorhimple. I want to say in terms of the Children's Hospital, that's for every child in Ireland potentially, and it certainly is for children in West Cork who need access to specialist treatment. And it's been a long saga. Without question, issues arose in terms of structures and all the rest of it. But what I'm in no doubt about, in the context of Crumlin or Temple Street or current services, the sooner we get this hospital built and operational, the better, because I think it would be absolutely transformative for children in this country, in terms of having single suites, in terms of the theatre capacity, infection control, particularly children with very vulnerable conditions. It will be, to me, transformative. And there's all the negative, and I understand it, and that's important, accountability, but we equally need to focus on what this will mean for the children of the country, including children from West Cork who will have to avail of these services.